Myth: mental illness is rare. Fact: 1 in every 4 college students have a mental illness.
Hold on to me as we go.
In the United States, those diagnosed with a mental illness oftentimes find it necessary to receive treatment from both inpatient and outpatient settings. However, there are structural differences between these treatment options, as well as limitations to access and quality due to stigmatization that can ultimately affect treatment outcomes.
People often attribute negative sanctions towards people with mental illness. In the United States, might be quick to judge mental illness based on reports in the media. I think if we were to look at that introspectively, we would see a great disparity between the real image of mental illness versus the imagined or purported image of what mental illness constitutes.
I think it leaves out the context in which people's illness exists. I think it leaves out other, psychological or social factors that can contribute to somebody having a mental illness or their symptoms worsening. In some ways, the medical model can and does reinforce the stigma, and the medical model really leaves out that the patient really should be in charge of their own recovery. They should have the greatest say.
When patients are hospitalized in a medical facility that doesn't primarily focus on psych, they may not get the full range of treatment that they deserve or need, which may lead them to another hospitalization sooner down the line. Also, insurance companies can play a role too if they won't pay for a patient to be there as long as it might seem like they should. If a patient is medically ill, insurance companies oftentimes will pay for a longer hospitalization.
With the inpatient setting, the advantage is you never have to worry about risk because they're just not going to stay safe on their own. The advantages of outpatient care is that it's teaching the client to manage their illness in the community. The society wants it to be managed in the community as well. It's cheaper than inpatient. It's not easy for people to get back to work sometimes, but we have all the services in place to help people with that. I think because of the stigma, people may not even come looking for treatment.
Education, as far as mental illness goes, is pivotal.
And through those conversations and through policy that may be developed as a result, we'll have a more holistic knowledge on health and illness and how it's meaningful.
For anybody struggling with a mental illness, don't let stigma get in the way. Do your research, talk. There's no shame in it, and it'll completely change your life.